dedicated to our high school seniors who are graduating this month. We are proud of the work they have done and the way they have adapted in the midst of what has likely been a tough and confusing year. Congratulations, and we wish you the best in your future endeavors. We'd like to spend some time today talking about the importance of wearing a mask or cloth face covering and how to properly do so. We want to start by saying that we know it can be easy to feel helpless and powerless in the midst of this pandemic. But we want to stress that you have the ability to take control of your health and protect yourself and the ones around you. You can do this by following the 5 core actions, which includes wearing a cloth face covering or mask. Now we'd like to talk about why you should wear a cloth face covering. We've received a lot of questions from people about why they should wear a mask in public since they feel perfectly fine and don't have any symptoms of COVID-19. Those are good questions, and we want to address them further. We'll start with how COVID-19 is spread. The primary way COVID-19 is thought to spread is through close-to-close personal contact, through respiratory droplets from an infected person. When they cough, sneeze, or even talk, droplets come out. And that's how a mask works. It blocks those droplets from coming out, so you don't spread it to other people. It may be possible that a person can get COVID from touching a surface that the virus is on, and then touching their mouth, eyes, or nose, which is why you say don't touch your face. That's not thought to be the main way the virus is spread. The key piece to remember is that someone doesn't have to be showing symptoms to being infected with the virus and therefore be contagious. Excuse me. These people are called asymptomatic or pre-symptomatic. As of today in Knox County, 22.6% of our active cases are reporting being asymptomatic. What makes this unsettling is that those folks can spread the virus without even knowing they have it. That is why it is so important to wear a mask when you're in public, when physical distancing can't be maintained. Because even if you feel fine, that doesn't mean you aren't putting others at risk. Now, I'd like to go over the proper way to wear a mask. I know this sounds basic, but it's very important. First, your mask can be something as simple as a bandana or a t-shirt. It doesn't have to be anything fancy. My mask that I wear most often was made by one of my colleagues by sewing a few pieces of fabric together. You should wash your hands before you put on your mask. So I'm going to use my hand sanitizer because I don't have soap and water up here at the podium. So then you take your mask by the loops, put it around your face like this. I'll try to talk loud enough so you can hear me, and loop it over your ears. If it's snuggly, this is the proper way to wear your mask. This is wrong, droplets can come out your nose, and this is wrong, droplets can come out your nose and mouth. This is the proper way to wear your mask. Take your mask off, loop around the loops, try not to touch the part that might have virus on it, and then hand sanitize again. So here we go. Wearing a cloth face covering protects the people around you. So even if you feel fine and don't have any symptoms, that does not mean that you don't have the virus and can spread it to someone who might be at higher risk for complications of COVID-19, or to that person working in the grocery store who's waiting on you. We know it's not ideal and it can be really uncomfortable, especially on these hot days, but the sooner everyone takes these precautions into their own hands in order to protect their neighbors, the more we can lower the rate of transmission in our community and make our way back to life as we knew it. Now moving on to our local situation. We have 494 confirmed cases of COVID-19 in Knox County. Additionally, we have 10 probable cases. 393 of our cases have recovered. 46 individuals have been hospitalized at some point in their illness. Currently, there are 3 Knox County residents hospitalized. We are thankful again to report we've had no additional deaths due to COVID-19 complications. And now I'll open it up for questions.
Okay, we have the first question from WBIR, from Paul with WBIR. Have you heard if it's safe to use the free Renfro masks from the state? And have you begun handing them out again?
I'm aware that there is a ruling by the EPA We are awaiting further guidance on definitively when we can begin handing those out from the state. Since those are from the state, we'll await their guidance on when we can begin handing those out again.
Okay, and from Tyler from the new Sentinel, the Federal Environmental Protection Agency told Knox News the state's face masks, which were previously handed out for free, are safe to use. I think that pretty much what she just said answered your question. I've just now seen your never mind. But any other media questions, if you'll please submit them into the chat feature and we'll read them for you. From Paul again with WBIR, do beards or other facial hair lessen the effectiveness of masks?
Not really. When we're talking about wearing the mask, you just want it to fit snugly, so it needs to cover your mouth and nose, and it just catches those droplets from coming out.
Okay, and another question from WBIR, 17 new cases today. That's another big increase. At what point is the health department concerned about the increases? And is it possible Knox County will move back to phase 1, or is this jump still expected?
I think we're still in that phase where we expect to see higher numbers of cases than we saw previously. Remember, we were only seeing 5 to 10 cases a day at the most. So now we're up to, in a higher number. What we want to see is that leveling off. We may level off at a higher number. Actually, I expect us to. But if we have that leveling off, our hospital system is still in good shape. Our staffing is in good shape. Some of the businesses where we've had cases have really helped us out by helping us with contact tracing. So things are going as we expected them to. But what I'd like to see this week is I'd like to see things start to level off. And we're hopeful that they will, as everybody continues to exercise those 5 core principles of social distancing, wearing a mask, staying home if you're sick, washing your hands, and cleaning surfaces regularly.
Okay, from WATE, do we know yet if summer temperatures or humidity affect COVID-19 spread rates or recovery?
And I know there's been a lot of chatter out there in some of the scientific community wondering if that might be the case. And we're just not going to know that until we're through the summer and we see what happens. It would be great if that were true, but I don't think I think the data is still up.
Okay, and another one from WBIR. With numbers going up, should I feel comfortable going to the grocery store? There's a couple here. Okay. Should people be going out like they did before, or is the recommendation to still stay home if you're able?
I think we still recommend people limit their outings and that they be conscious about, do they really need to go to that outing or to that event? So we're recommending people limit their outings. We're recommending people, when you're outside your house, 5 core principles aren't just for home. Outside your house, follow those 5 core principles, protecting yourself and others. Washing your hands is so important in this situation because, again, you touch your eyes and face and potentially infect yourself. So that's something important to remember. I think people need to also say, given my age, my health, my other risks, am I comfortable going out or not? If you're not, then it's totally okay to stay home.
Okay, from Brian Hornback, have you set the next reopening task force meeting?
We haven't. We'll let you know as soon as we do that.
Okay, and another one here from WBIR. I know that you all don't report testing numbers, but can you explain whether testing in Knox County is increasing? Is the percentage of positive tests going up? So
there's a challenge in being able to use the testing numbers that we are able to get and predict it and using it to say the percentage of positives. Our number of tests is really just an estimate. It's really just a sample of what's being done throughout the county. So using that to determine the positivity rate really wouldn't be appropriate. So what we know is that our testing is increasing. There's been some variation a little bit, but the trend still continues to be up. Our hospitals are testing folks who are going for procedures. Doctor's offices are testing. Urgent cares are testing. We are testing every Monday, Wednesday, and Friday at our here at our Dameron Avenue location. It's walk-in. You don't have to have an appointment. Anybody can be tested. And we're also testing, because I'm testing on Tuesdays and Thursdays, doing targeted outreach.
Okay, from another couple from WBIR. We've seen marches with hundreds in attendance in Knoxville and surrounding areas. Should those people get a test, and do you have the capacity to test them?
We have the capacity to test close to 100 people each day, maybe more, and anybody can get a test. I am on that vein. I would also say A test is a moment in time. It tells you don't have it right now. We're not recommending that those folks get tested unless they want to, unless they're concerned that they were exposed or they just want to know if they have COVID right now. I think what I would say to those folks, if you choose to go out to protest, try to maintain social distancing. If you can't do that, we really want you to wear face masks. We don't want you to put yourself or others at risk.
Okay, and the last one for now from WBIR. Do the numbers in surrounding counties influence your decision to move forward or pause at all?
We certainly look at the numbers in other counties and get that information from the state of Tennessee as well. But really not a big influence on our decision making here locally.
Okay, and from Megan from WVLT. For families who are taking summer vacations in other states, should anyone who has traveled considered self-isolating after returning to Knox County?
I think that depends on if you travel somewhere and you think you got exposed to COVID-19, you might want to consider self-isolating when you come home. There are no guidelines regarding travel in the United States at this time.
And another one from a WVLT viewer. Can you explain how we know that masks help prevent the spread of COVID-19?
I think there's a limited body of evidence, but there is some evidence out there. There was a report published in the Lancet, which is a medical journal, and the World Health Organization just came out with some information. So we do have some information that it does limit the spread. So again, we talk about how it limits the droplets coming out from the person who might be sick. It's also been long practiced. People wear masks in medical settings and other places to protect others as well.
Okay, from WATE. One of our viewers asked if you could give context on the COVID-19 infection rate and how it compares to the overall Knox County population. How also does that compare to the seasonal flu?
Well, so what we do know about COVID-19 is that it is more contagious than seasonal flu partly because we don't have an immunity to it. It's brand new for humans, and so we don't have immunity. So it's a lot easier for us to catch it because we don't have that immunity and actually get sick. We will be talking more about data on Friday. Calculating our infection rate is really more about predicting, and we haven't really been using that as one of our benchmarks.
Okay, if there are any other questions, if you'll please submit them into the chat box and we'll read them for you. Okay, seeing none, that's all for today. Thank you very much for joining us, and we'll see you again on Wednesday. Have a good day.